talk about innovation, it is not, a copy and paste innovation that has happened elsewhere, but it has to be a significant departure from the traditional way of thinking we have about financing, healthcare services.
Innovation in a sense that even with the resources that we get, how can we ensure that that resource is efficiently and effectively used? Because even if we get $100 million, is it being efficiently and effectively being used? I think that is another way of innovation, in a sense that we need now to start prioritizing in terms of our activities, in terms of what we think we will need in the health sector, is also to look at the citizens' responsibility. Because we keep on talking about finances. What responsibility and ownership is the citizen?
What is most important is to have financing structures which combine not just the government but also the private sector. We are collaborating with the private sector to create what we call operating lease structures, which can finance medical equipment over the next 10 years, as opposed to buying them outright.
Because in the African region, usually financing for health, for example, is left for the government. So we are innovative financing should be in such a way that how do we carry the community along, the whole populace along.
Money comes from the total budget, from the fiscus, and it finances us from the same pool. But because of different competing interests, it is impossible to do that adequately. So we've got to think out of the box and see if we can get other ways, other models of financing healthcare in Africa.
The way I would put it is that we need, as member countries, specifically let me speak from the SADC region, to support each other so that these private partners who come on board to bring resources for us to improve our health sector.
It means reviewing whatever strategy we've been having. It means looking at alternatives. It also means having the political will and the determination. So innovation to me means going beyond the norm, means accepting that it's possible to find solutions that are not the usual ones.
I think when you look at innovation in health, the first thing is that it has to be delivered by people. Healthcare is done by individuals to individuals. So when you look for innovation in healthcare, I think what we need is new technologies. And I think that's something which would really contribute to healthcare, mobile phones, mobile devices. When it comes to financing innovation, probably the best thing we could do would be to get more value for money. And perhaps monitoring how we spend money would be really innovative. And perhaps holding people accountable for how they spend money would also be innovation, because it hasn't been done properly so far.
It's moving away from the old system of things to coming up to the new system of things. And innovation helps in terms of sustainability and in terms of how are we going ahead. In Kenya, we have started up a sustainability fund for HIV, AIDS, TB and malaria.
Innovation it has to be something different, something unique, and it can't be business as usual. And it has to be sustainable. By sustainable, it then needs to have community participation, community ownership, and it has to be homegrown.
Looking at new ways, new approaches, having to learn from experiences of other people that have worked and adapting those experiences to suit the needs of our various communities or localities, and in this case, the African continent.